Sue and Marty have a great passion for travel all over the world. For those who saw her presentation on the Jews of India, you can appreciate that. And she has been to Israel 8 times. She likes to get off the beaten path in her travels and can get lost equally well asking directions in Hebrew or English. Pardon me. Sue has spent her life as a Jewish educator and committed community volunteer. She has a BS degree in education and a master's degree in Jewish studies. She has taught all grades in supplemental Hebrew school, first grade in a Jewish day school, director of the Akron Jewish Community High School, and on the faculty of the Florence Melton Adult Mini School in Akron. Sue has held almost every position in her local Hadassah chapter, including president for 7 years at various times. She and Marty are both very, very active in the synagogue, and we look forward to this presentation. Before I mute myself and turn the program over to Susan, we'll have Sue speak for about 35, 40 minutes or so. Then we'll have about 15 minutes of Q&A, give or take one way or the other. Please remain muted. Any questions during the presentation, please hold on to them, send them to me via the chat. We'll get to the chat questions first, and then we'll scan the audience later on for questions about the program. So I will mute myself and turn the program over to Ms. Spector. All right, everybody, thank you very much.
Thanks, Marshall. Like many other topics, we may end up with more questions than answers when it comes to learning about Jewish things. Public health and medicine have made immense strides in the 20th century. We've seen life expectancy double in the last 100 years. Some of the preventive measures that we use today are already found in ancient and medieval times. The Torah knows about the preventive significance of quarantine. The Talmud proclaims as a general rule that physical cleanliness is conducive to spiritual purity. And the Talmudic Rabbi Samuel declares that washing one's hands and feet in the morning is more effective in securing health than all the lotions in the world. Water left standing uncovered was considered unfit for human consumption, and water suspected of being contaminated had to be boiled before use. Maimonides teaches which foods are best eaten with which, and he cautions that one should not eat too much in the first place, and that one should exercise, advice with a remarkably modern ring. With new capabilities to preserve or enhance life come new moral problems. When one cannot do something, there's no question if you should do it. But when one can do something, however, then whether one should do it is often a critical one. In making decisions, individuals look for different sources of authority for guidance. Today's family physicians and specialists in this case. But communities also need to determine how social planning, public policy, finances, even politics will affect their decision. Judaism can guide us in moral questions in general and questions of medical ethics in particular. Jewish law can offer guidance, and the way in which conservative Judaism looks at it may often differ from Reform or Orthodox traditions. Tonight, much of what I will say comes from Elliot Dorff's book, Matters of Life and Death, A Jewish Approach to Modern Medical Ethics, and to the responsa of the Law Committee of the Rabbinical Assembly, written by Rabbi Micah Peltz, unanimously approved on January 1st, 2021. It's interesting that this teshuvah was fast-tracked to provide guidance in this important matter, just as the vaccine itself was fast-tracked. There's also been a lot of information on the internet, different sources that I was able to access. For Judaism, God owns everything, including our bodies. God lends our bodies to us for the duration of our lives, and we return them to God when we die. Thus, neither men nor women have the right to govern their bodies as they will. These rules require us to take responsible care of our bodies, just as we would need to take responsible care of an apartment on loan to us. So, for example, Hillel regards bathing as a commandment, a mitzvah, and Maimonides includes directives for good health in his code of law, considering them just as obligatory as other positive duties like caring for the poor. Ultimately, Jews have the duty to preserve their own lives, pikuach nefesh. When interpreting Leviticus 18:5, which says that we should obey God's commandments and live by them, the rabbis deduce from them that that means we should not die as a result of observing the commandments. Pikuach nefesh takes precedence over all other commandments except for the big three: murder, idolatry, and incestuous or adulterous sexual relations. Jews are commanded not only to do virtually anything necessary to save their own lives, they are also bound by the positive obligation to take steps to save the lives of others. This imperative is derived from the biblical commandment in Leviticus. Do not stand idly by the blood of your neighbor. This means, to take the Talmud's example, that if you see someone drowning, you must not ignore him or her, but must do what you can to help save them. It doesn't mean that if you don't know how to swim, that you should jump into a fast-moving river, but you should do what you can. It might be throwing some kind of a life-saving device to them, or it might be calling for help. But you can't just stand by and ignore the situation. What happens, though, when you can only save your life or someone else's? Whose life takes precedence? We often hear like the joke about the rabbi, the priest, and the minister who are in the lifeboat, but the idea of what happens when you can't save everyone's life? Whose life takes precedence? The Talmud addresses this dilemma in a well-known story about two people who were walking in the desert. Well, there were two people walking along a deserted path, and in the hand of one of them was a jug of water. If both of them drink, they will both die before they can reach another place where they can replenish their water. If one drinks, he will reach an inhabited place and survive. Ben Patura explained, it's best that they both drink and both die so that one doesn't see the death of his friend. But Rabbi Akiva taught, let him live by your side. You should not exact interest from a fellow Jew, Leviticus tells us. That requires, though, that you must be alive before you can care for your brother, for otherwise he cannot possibly live with you. Thus, your life comes before the life of your companion. Though Rabbi Akiva thinks that an individual should put his life first, most commentaries assume that he made this rule because a jug of water was clearly owned by one of the two individuals. If it had been a shared jug of water, then it's possible that the Rabbi Akiva would have ruled differently. It's suggested that whoever has the jug of water when a shortage is discovered should keep the jug of water. But it's important to note that no one suggests that the person who did not bring the jug of water should take his friend's jug. That would be stealing, which is more serious, and perhaps even more serious than this, since it would lead to his friend's death. It might be murder. Even though the friend's life is in danger, this is not a case where he would be justified in taking the other person's jug of water. They may both die anyhow, but that would be a result of nature, not something that they determined. Another source for the obligation of caring for the life of someone else is a commandment of the Torah, perhaps a surprising one. The sages of the Talmud explained that we learn this obligation from the commandment to return a lost object. The Torah teaches, don't see your brother's ox or his sheep wandering in the way and ignore them. Surely return them to your brother. The very next verse reiterates in Deuteronomy, return it to him. And as you know, the Torah doesn't use words in a repetitive way unless there's a very special reason. From this, the Talmud infers that there is another kind of return, restoring a person to himself. A person's well-being, including his health, so to speak, belong to him. When a person is ill, he's lost something precious. Others are required to do their best to restore his health to him. We must take care of ourselves first, but not at the potential cost of others' health and well-being. Does this relate to using one's connections, influence, or financial means to move up in the vaccine line? While an individual physician is rarely permitted to withhold resources from a dying patient to ameliorate future need, society may have a different set of ethical standards. May we take future societal needs into account during this pandemic. Jewish law recognizes society's legitimate future communal needs. The Talmud in the Nedarim 81 describes a scenario in which two cities share a water supply that originates within the community atop of a hill. We might be experiencing this in our own day as Florida has the problem with people accusing the water in Lake Okeechobee of not being released in the agricultural grounds south of this, not getting the water they need. Or you might think of Israel, where there's always the issue of the Jordan River and whose water is it. The Talmud rules that the upstream community takes precedence if there's only enough water to provide drinking water to one community, because the water belongs to the upstream community. This decision is in full accord with Rabbi Akiva's position on the one flask of drinking water in the desert. But what if the upstream community wants to use the water to bathe and wash clothes? And the result will be a shortage of drinking water for the downstream community. In this case, the Talmud has a disagreement. While the majority opinion forbids the first city to hoard water for bathing and washing clothes, if the second community will lack drinking water, there's an opinion of Rabbi Yossi. As you know, in the Talmud, whatever there's one opinion, there's always another opinion too. He permits that the upstream community keep the water. Why? He accepts the opinion of a physician rabbi in the Talmud who felt that abstaining from bathing and washing clothes could result in the development of a life-threatening illness. Therefore, according to his opinion, the second city's situation, even though it's in present danger, the upstream community can have the water, and because there may be a grave future danger. The Torah also commands us to be careful and watch yourselves, which is understood by the Talmud to mean that we should avoid danger whenever possible. Elsewhere in Deuteronomy, we find the mitzvah of placing a parapet or a guardrail around one's roof. Now, this probably would not work real well in Sarasota, Florida, where most of us have slanted tile roofs. But it did work with slanted roofs in the Northeast in hundreds of years ago, where the wife would go out and look on the roof surrounded by the parapet to look for her husband, the sailor, coming back from his voyage. This is understood that we must take steps to protect ourselves and others. As Rabbi Moses Isserles clearly articulates in the Shulchan Aruch, one should avoid all things that endanger oneself, and we should treat physical dangers more stringently than even ritual prohibitions. This is a short summary of the many sources that make it clear that taking preventive measures during this time of pandemic, like wearing masks, washing your hands, maintaining physical distances, are not just recommended, but are obligated by halakha, Jewish law. If there's even a chance that our behavior can protect our lives and the lives of others, then that would take precedence over any other consideration. Okay, let's take a look for a minute at society. What role does a society play when we make healthcare decisions? Do we take numbers of people saved into account? It's fairly well accepted that given the choice of saving many people or a few people, we should save the many. For example, if there's a disaster, we have to choose between saving a single person on the one side or a group of 10 on the other side, we should save the group. This is because we maximize the lives saved without directly causing harm to those not saved. By saving the many, we have not directly caused the deaths of the few. But despite the above discussion, maybe the rules governing society are not different from those governing the individual. Is society merely the aggregate of two or more individuals, or is it an entity into itself with its own set of ethical parameters to consider? Simply, can a government official make a societal decision, or is he bound by the same constraints as an individual, including taking care of the sickest individuals first and ignoring the possible benefits of investing in medical research for the future? There's a clear indication that Jewish law considers the needs of society to be unique. The Talmud in Gittin 45a considers the case of ransoming captives. Now you might wonder, what does that have to do with COVID? It was common in Talmudic times for criminals to kidnap Jews for exorbitant ransoms, relying on the Jewish obligation to ransom captives to pay them the money they wanted. Therefore, for the benefit of society, the Talmud forbids one to ransom captives for more than their value. We see that overall societal health can take precedence over saving an individual. But the Talmud also says that communal needs may take into account future circumstances and dangers, and that communities may refuse to spend money now to avoid hardship later. Some use this concept as the justification for society's budgeting money for playgrounds, parks, and culture, something we may not consider really important right now, since a healthy society needs those items. Based on the above arguments, Rabbi Moshe David Tendler, a contemporary rabbinic authority, claims that when planning for long-range societal needs, we may treat future generations as if they were before us now. People who may develop a disease in the future may be treated as if they were currently our patients, and we do research as the means by which we treat them. Nevertheless, we must be vigilant in exhausting all possible avenues to provide complete care for all sick patients who are currently ill. And perhaps this was a taxing thing on our medical system, as they not only had to take care of those that were very sick in the beginning, but as research to see how better to care for them and to develop a vaccine. Another rabbi limits this concept, warning that the redirection of communal funds for research and development is justified only if there are currently living people who will develop the deadly disease, because ordinarily Jewish law would not recognize the claims of future generations when weighed against people currently in danger. So you can see there's difference of opinion. Communal ethics differs significantly from individual ethics, and society must take into account the long-range effects of its decisions. Dr. Avraham Steinberg, author of the Encyclopedia of Jewish Medical Ethics, is careful to point out that we are not killing the currently ill patients to save those later on, but choosing to allocate a governmental budget in a way that best serves the needs of society. This stands in contrast with the physician who must exert every effort to treat the patient who is sick before him and may not refuse treatment now because another sick patient may come along in the future. Our modern society considers some lives more valuable than others. In the simplest terms, the ultimate value of Western society is productivity. People's lives are considered valuable as long as they are producing, regardless of the benefit what they are producing has for society. A person in a coma is perhaps the perfect example of a non-producer. But the Jewish view of the value of life is drastically different. According to Judaism, a soul descends into this world and dons a physical body in order to accomplish a unique mission and to effect a particular tikkun. Every human life is valuable, and even in the most disabled body, the soul can still accomplish its work. If a 90-year-old comatose patient was the only perfect match to donate a life-saving organ to the world's most celebrated person, but by removing that organ, the man's life would end 1 minute sooner than otherwise, it would be forbidden to remove the organ, because every minute of life is valuable, and no one's life is considered more important than another's. The duty to provide health care applies not only to the individual physician, the community itself is charged with making it available. As we read in Leviticus 19:16, nor shall you stand idly by the blood of your fellow. The Talmud explains our obligation to provide medical aid, especially to the poor. And we read in other places to the widow and the orphan, but to include expending financial resources to accomplish these goals. But the community is also responsible for providing other necessities of life, security and our utilities, so many things that our community has to deal with. So we have to be aware of other needs as well. Medical is not the only thing. Okay, what about the vaccines? Now that vaccines for COVID-19 are available, is there an obligation to be vaccinated? Can Jewish institutions require vaccination for employees, students, congregants? What should be their guidelines for distribution? Rabbi Shmuel Herzfeld from an Orthodox synagogue in Washington, D.C. says, I believe the scientists are holy people, and all the workers up and down the line who made the vaccines possible are incredible holy agents of our Creator. Rabbi Danny Schiff, foundation scholar at the Jewish Federation of Pittsburgh, who was in Sarasota a year or two ago, says vaccination does two things. It preserves your life and others. Judaism wants to preserve the well-being of the individual, and the idea is we also have a responsibility to each other. Rav Shoshana Mitrani Knapp, ordained in the conservative movement, explained the idea in Leviticus that you shall love your neighbor as yourself is consistent with the mandate to be vaccinated. There's a beautiful understanding in the Talmud that whoever sustains one soul has sustained the world. When Cain asks in the Torah, am I my brother's keeper? The answer should be yes. When it comes to vaccines, we can say the same thing. Back in 2005, the Law Committee of the Rabbinic Assembly overwhelmingly approved a teshuvah by Rabbi Joseph Prauser entitled Compulsory Immunization in Jewish Day Schools. The question posed was whether Jewish day schools could grant an exemption on religious grounds for a child whose parents refused to permit vaccinations. Rabbi Prauser, after a thorough examination of the sources and contemporary medical research, concluded, failure to immunize children against vaccine-preventable disease is a serious compound violation of Jewish law. There is no basis in halacha to support a parent's request for a religious exemption from state mandated immunizations. Though the issue for Rabbi Prauser is vaccinating children, it is clear from the sources he presents that vaccination would be a mitzvah, a commandment for adults as well. Indeed, this is the conclusion that Rabbi Elliot Dorff comes to in his book, Matters of Life and Death, when he writes, with its strong sense of community and duty, the Jewish tradition would have us use communal measures to preserve our lives and health as much as possible. It would be a violation of Jewish law, for example, for a Jew to refuse to be inoculated against a disease, at least where the inoculation has a proven track record of effectiveness. Jews, on the contrary, have a positive duty to have themselves and their children inoculated against all diseases where that preventative measure is effective and available. This is the position taken by most halakhic authorities today. It would seem then that there's an obligation to be vaccinated against COVID-19. A discussion ensued in the Law Committee's evaluation of the safety and effectiveness of these fast-track vaccines. Citing earlier sources relating to the smallpox vaccine, they determined that these earlier decisions regarding the smallpox vaccine were similar to the COVID-19 vaccine and concluded that the testing met the requirement of refuah b'duka, an established treatment, and therefore we would be required to vaccinate. Additionally, the Orthodox Union and the Rabbinical Council of America have also ruled that there is a requirement to be vaccinated for COVID-19. It's important to note that all these obligations to vaccinate also require the individual to do so in consultation with a personal health provider. Given all this, it's clear that all of those whose doctor recommends vaccination are obligated by halakha to be vaccinated against COVID-19. Okay, let's look about it and how it affects our Jewish community. Rabbi Prauser's 2005 Teshuvah thoroughly addressed the question for Jewish day schools. He concludes, unless a specific immunization is medically contraindicated and so documented by a reliable physician, unvaccinated children, even those who, in violation of Jewish law, have secured a religious or philosophical exemption from the state, are properly denied admission to Jewish day schools. The halakhic sources and reasoning behind this teshuvah resonate with our current situation and the requirement to vaccinate against COVID-19. Therefore, from the standpoint of Jewish law, it's appropriate to extend Rabbi Prauser's ruling to any Jewish institution to require vaccination against COVID-19 for its participants, whether they be employees, students, or congregants. Jewish institutions should consult with their legal counsel for guidance on this question from the perspective of secular law. But that is the Judaic perspective. What about distribution? The ethical questions that guide the fair distribution of the COVID-19 vaccines are complicated. As those of you who have spent hours on the computer and phone trying to secure a site for your own vaccination can attest to. Questions can be asked on at least 3 different levels: global, national, and personal. What obligations, if any, do rich countries have to poor countries in sharing the vaccine? Within a country, how do we decide who gets the vaccine first? As individuals, do we each have an obligation to wait our turn, or are there circumstances where one could jump the line? These are complex questions that many committees on ethics and governments are in the process of working through. Our Jewish sources also give us insight into these questions. It's important to note, however, that the principle of Dina de Malchutacha Dina, the law of the land is the law, applies to vaccine distribution. In other words, We are obligated by the decisions made by our government on these matters. Still, especially when it comes to the personal ethics of vaccine distribution, our tradition gives us guidance and provides perspectives. In March 2020, just a year ago, as this began to take place in our lives, the Rabbinic Committee approved two teshuvot, one by Rabbi Dorff and one by Rabbi Nevins, on triage during a pandemic. These teshuvot were dealing with allocating life-saving treatment, such as ventilators, during a pandemic. In their writings, Rabbi Dorff and Rabbi Nevins lay out criteria for making a determination of who should get what. Rabbi Nevins refers primarily to the allocation of scarce medical resources to already infected patients. But his discussion of pre-infection triage of PPE, the personal protective equipment, is helpful for the discussion of vaccines as well. Two topics should be considered when considering who do we treat, person A or person B? And the two criteria they use are who is in most immediate and grave danger, and is one victim terminally ill. Jewish law differentiates between brief survival, chaye sha'ah, survival for an hour, and long-term recovery, chaye olam. Within a year of survival is the criterion they use. Determining who is in most immediate and grave danger is an important consideration. It substantiates the initial phase of vaccination, which prioritizes healthcare personnel who are working with COVID-19 patients and residents of long-term care facilities who tend to be more vulnerable to the spread and severe consequence of the virus. But the second point has raised more difficult questions, as some studies have shown that the elderly may not benefit as much from vaccination if their immune systems are already compromised. This, though, is unproven and controversial, and so it's still under discussion. In his teshuvah, Rabbi Dorff identifies four moral principles for determining how to allocate a community's limited resources. It wouldn't be a problem if there was immediate sufficient vaccine for everyone to get it. The question comes when there is not enough for everyone. He feels, number one, we should treat people equally, either through first come, first serve, as Sarasota has done with their sign-up list, or through a lottery, as Manatee County has done. Second, you could favor the worst off on the basis of the rule of rescue. Number three, maximize total benefits, utilitarianism, measured either by the number of lives saved or the number of life years saved. Or lastly, promoting and rewarding social usefulness based either on instrumental value for the future of society or on reciprocity for past contribution, including those on the front lines of fighting COVID-19. These principles, based on Jewish sources, are helpful in thinking about the ethical distribution of the vaccines. While ideally everyone in the world would get equal access to the vaccine immediately, this is not possible given the vaccine's initial scarcity and logistical challenges. Still, these principles are helpful guidelines in thinking about global and national distribution. Favoring the worst off would lead us to prioritize those most vulnerable, such as the elderly, the immunocompromised, and our minority groups who have historically been discriminated against in healthcare. And here in Sarasota, there's been a lot of media attention given to the poor Black residents in Newtown, perhaps, who did not have easy access to computers or transportation. Maximizing total benefits compels us to protect the public's health, which also includes socioeconomic well-being in the short and long term. Many of our politicians are very concerned with that. Promoting social usefulness makes us consider how we can best vaccinate those who help others for the benefit of all of us. And what about when it comes to global distribution? We see the rise of vaccine nationalism. It has made implementing these principles even more complicated. Vaccine nationalism occurs when countries seek to inoculate their citizens before everyone else. While protecting our citizens is a top priority for all countries, it also leads to greater inequality of distribution. According to the Duke Global Health Innovation Center, which tracks vaccine procurement worldwide, there will not be enough vaccine to cover the world's population until 2023 or 24. This is due to a lot of factors, but one major factor is wealthy countries stockpiling vaccines. To help level the global playing field, Gavi, the Vaccine Alliance, the World Health Organization, and the Coalition for Epidemic Preparedness Innovations have promoted COVAX, a worldwide platform to support the research, development, and manufacture of COVID-19 vaccines. More than 118 countries have signed a pledge to participate in this initiative, including Canada, Israel, and much of Europe. And I have to thank Ben Sachs, who I emailed yesterday and said, what about the US? Because from what things I read, the US had not signed on. But he sent me an article from the New York Times that for several weeks now, Biden has announced that the US will sign the agreement or has signed it and will help the world situation. But I've also read in the newspaper that he intends to take care of our citizens first. This initiative would help put our values into action and working toward a more ethical global distribution of vaccines. Only somewhat less complicated is the ethical distribution of COVID-19 vaccines within a country. In the US, guidelines for distribution are made for the Centers for Disease Control, the CDC, based on recommendations from the Advisory Committee of Immunizations Practice, an independent organization. This independent group of medical and public health experts whose recommendations are based on the following ethical principles, similar to those of Rabbi Dorff. I don't know if they read the book or thinking alike. Maximize benefits and minimize harm, mitigate health inequities, and promote transparency. To summarize all this, we must take care of ourselves first, but not at the potential cost of others' health and well-being. Taking preventive measures against the spread of COVID-19, such as wearing masks, frequently washing hands, and physically distancing are mitzvot and mandated by halakha. COVID-19 vaccines approved by government health agencies under emergency processes are considered to be refuat betukat, established treatments. With proper medical guidance, Jews are obligated to be vaccinated against COVID-19. Jewish institutions are permitted by halakha to require their employees, students, and congregants to be vaccinated against COVID-19. It suggests legal counsel should be consulted to understand the secular law as it relates. Considering the ethical distribution of COVID-19 vaccines globally and nationally requires us to apply our Jewish moral principles of treating people equally, favoring the worse off, maximizing total societal benefit, and promoting social usefulness. Dinah de malchutaka dinah requires us to accept the distribution priorities made by our governments. And finally, using personal connections, influence, or financial means to receive the COVID-19 vaccine sooner than our allotted time is forbidden. Finally, when we get the vaccine, what blessing do we say? We know that Jewish liturgy offers blessings for seemingly every occasion, from ritual moments like lighting the Shabbat candles to sublime experiences like seeing a rainbow to mundane acts like going to the bathroom. But what bracha should you say when you get the COVID-19 vaccine? MyJewishLearning.com, another wonderful internet site, asked a number of rabbis this question, and I'm going to share just a few of them. Rabbi David Wolpe from, I think, Los Angeles, said he would say three. He would say the Shechianu blessing, thanking God who brought us to this day. He would also say the She'asa li Nes Makom Hazeh, who has done miracles for me in this place, and Shanatan Mechamata Lebasarva Adam, who has given of his wisdom to flesh and blood. Rabbi Emily Cohn of the West End Synagogue in New York City would invite each member of her synagogue to bench Gomel, a prayer said by Jews who've come through a harrowing threat to life, like giving birth, a major illness, or a car crash. Another rabbi suggests that he would say the Shehechianu, as this prayer is said when meeting a friend you haven't seen in 30 days. And with this pandemic, many of us haven't seen our friends in a lot longer than that. Thank you.
Well, there certainly is a lot to unravel on that lecture. So thank you very, very much, Sue Spector, for that. I do see a question on the chat from Evie Mitchell, and I'll read that. And Sue would like to hear your thoughts. A couple of, here we go. Let me just, Joe will just chime in here, hang on. Evie says, according to what you said, conservatives believe that we are obligated to get vaccines. How do we explain the number of Orthodox or Chabad groups that are anti-vaxxers? I guess that could probably be, to follow what Joel said, like extremists in every religion, those in the Haredi movement choose to interpret the Torah to suit their own point of view, in this case, denying science. What would be your comment on those points?
I guess I have no real answer. You would think that Haredi Jews who put so much emphasis on Jewish halacha would go by what it says. But I guess some of them perhaps believe that God will protect them, but I don't know, maybe someone else has a better answer to that.
Joel, chime on in.
Actually, what Sue just said is exactly what is reflected to me by my fairly devout Christian friend, my neighbor across the street, who, when we talk about this, about wearing masks, about about getting vaccinated, all of these issues, basically, she says what Sue just said. God will protect me. Jesus will protect me. You can't be afraid of it. Basically, parroting certain political views on the issue instead of the science. And yeah, they look at it that way. And you cannot influence them in any way. You cannot talk them out of it. And when I asked her, and you said you can't be afraid of it, well, I said, do you go to the doctor? Yeah. Why do you go to a doctor? Did you get vaccinated against the flu and all these other things? Yeah. Why? And then they just, push it aside.
Whenever we do a picture of the creation story, we always have God's hand in the upper corner. And the idea is that we're partners with God in creation, that it's an ongoing process. But if people refuse to listen to science, I'm not sure what the answer is.
I have a frequent interaction with the Chabad in Lakewood Ranch, and I know that they are very, very serious about having their people vaccinated and social distancing, not meeting when in shul and wearing masks and so forth. So I'm not sure whether there's just certain sections within a Chabad. I know it's not universal within the Chabad, I can't speak for the Chabad here in Sarasota or other Chabads, but I know that there are certainly some Chabads that do
There's a
believe in
rabbi here.
vaccination. Rabbi Ed, please speak up.
Yeah, I think equally essential question, actually proposition in the Torah itself, in the Bible, and in rabbinic literature, is that we need to turn to our healers, our physicians, for both guidance and treatment. And that is a priority throughout Jewish history and religious circles too. So those who decide not to do so are really departing from a core part of Jewish tradition.
Any other question? Let's see, I think I missed something. Wait a minute. Rabbi Ed is unmuted. I was gonna say Mrs. Zimmerman, Ms. Reisberg, please.
I don't know if this has anything to do with it, but I was unaware of this particular fact. But I heard today a bishop was letting his congregants know that despite the fact that some of the vaccines are made from, he said, fetal tissue, that they were, that he said if that was the only vaccine that they could get, they should get it. Is any of this objection from certain elements of the Jewish community, are they objecting to the fetal tissue perhaps? I have no clue what's going on, but I never even knew that this was an element in some of the manufacture. Anybody have any light on this?
No, I did hear the same thing with the Johnson & Johnson. There are some, there's origin of certain in the manufacturing process of somehow fetal tissue or aborted fetal tissues. And so the clergyman did say, if you have a choice, you should get the Pfizer or Moderna, but if you don't, then to take the Johnson & Johnson. I can't shed any light on anything else other than what Ronnie just said. Well, let me just see if I missed anything else. Dr. Wynn says wearing a mask and getting vaccinated is as much as about protecting others as yourself, the golden rule. We heard that from Ms. Spector. So as I look around, I want to thank Sue Spector again for the great, wonderful presentation. And I think that it was a valuable hour spent. And, oh, I missed, did Yvonne have something? What did I miss?
Oh, yeah. Can you hear me?
Yes.
I just wanted to say what Ronnie was talking about. My understanding is that while some fetal tissue is used in testing the process and whatever, it is not in the vaccine itself. There is no fetal tissue in any of the vaccines. Okay, that's what I heard from Dr. Wang or whatever you just mentioned today.
Oh, thank you for that clarification. So without any further ado, Mr. Tridell, do you care to close out the meeting with any words of wisdom? And again, special thanks to Joel Servitz and Elliot Korn, our Zoom technical masters.
Just to basically echo what Marshall had to say, I want to thank Sue for her presentation this evening and adding some new dimensions to our understanding of how Judaism deals with issues like this. And we also want to thank all of you for being here, and please come back again on Sunday and again next week. We love to see all of you and bring along friends and family.
Thank you again, ladies and gentlemen.